was the end of February. I had the fridge full of leftovers. It was going to be a relaxing weekend. I was finally determined to defeat Ganon and finish the game, The Legend of Zelda Breath of the Wild. But the truth is that it was terrifying. The closest thing to something I'd felt before was kind of a pain in the pit of my stomach. The possibility of a heart attack crossed my mind like an evil shadow that you sense on your back, but when you turn around, it has already disappeared. I was trying to convince myself that it couldn't be. The classic sign of pain on the left arm was totally non-existent. I had no previous record that pointed out to cardiovascular problems. Quite the opposite. That, added to the terror it caused me the possibility of problems with my heart, made me rule out that possibility. So after 4 or 5 days, I did what I probably should have done before. I took a taxi cab and went to the Delphos clinic. Hey crazy truckers. Once I entered the hospital emergency admission, a very kind doctor asked me a few questions. He wasn't buying my indigestion theory. He seemed more interested in the flu I had a few weeks prior and the possible consequences in my pericardium. My worst nightmare, the evil shadow, was back, and this time it was more frightening. They began to run different tests on which I remember very little. First, an electrocardiogram showed tachycardia and anterolateral subepicardial injury. I'm not sure if I butchered that. I do not remember those tests because I lost consciousness shortly after. I don't know if they gave me any sedatives or I was already in my last legs. From that moment on, all my memories become blurry, kind of like unrelated flashbacks. My recollection of the facts is a mixture of the little I remember and the things people have been telling me afterwards. And I have been incorporating them into my story the best I could. Medically speaking, things precipitated quickly. I think I was admitted to intensive care. According to the medical report, emergent coronary angiography is performed, showing coronary artery disease of the vessel with acute occlusion of proximal segment of the anterior descendant artery that is revascularized by implantation of a drug-eluting stent. Again, I'm not really sure if I butchered that, most likely. Fortunately, Marco, my ex-wife's partner, was working in the hospital that day, and he called her regarding the situation, which triggered a cascade of events with my family. My ex-wife called my mother, who did not forget to reproach me for not calling her myself. And soon, my whole family was on the way. I was groggy, and as I say, everything is really blurry. But one of the things I remember is seeing my mother, my brother, and my sister coming to visit me. From my perspective, lying in bed, they were a bit like that game that moles came out of their burrows and you have to hit them in the head. Guacamole. Yeah, something like that, I think it's called. The last thing I remember at the Delphos hospital is a visit from Susanna with my eldest son. The only thing I managed to say was, my son, so tall, so handsome. My half-delusional words alarm my son, knowing that I'm a rather shy guy and have a hard time saying that kind of things. It seems the situation was getting worse. An echocardiogram confirmed a hole in the septum. When it rains, it pours. The Delphos hospital, as good as it may be, it wasn't ready for such a critical situation. I was dying. A transfer to a big hospital seemed the only option. The possibilities of a private hospital with my private medical insurance were reduced to the Technon hospital. In this regard, Spanish public health is way more advanced. From Valdebrón to Belviche, going through San Pau or Hospital Clinic. Luckily, Susana, quite knowledgeable on the subject, signed up the papers, so they transferred me to the Belviche Hospital, one of the most cutting-edge hospitals in the country when it comes to cardiovascular issues. They put me in a mobile ICU with a cardiologist and a nurse. The little I remember is the doctor checking my vitals in the ambulance, telling me that we were almost there and everything was going to be all right. Although his facial expression didn't quite agree with his words. When we entered the Belviche Hospital through the emergency admissions gate, it was already dark. If you think someone you know may like this video or it can be somehow useful to them, share it. The bigger the conversation on this topic, the higher the chances of reaching some understanding. And who knows, maybe also of reaching that eureka moment that is so cool. Don't miss the next chapter, Belviche and the ICU, or somebody help me.
Smell you later.